Our next topic is shock. Now this topic gets misunderstood quite a lot. So we're talking about medical shock and what can cause it, what are the signs and symptoms to look out for, and how to treat it. Now there's different types of shock that people can think of. So there's anaphylactic shock, so to do with allergies. You've got emotional shock, when you've seen something quite emotional and it's very distressing, like a lost member of family or friend, or a car accident. You might have go into shock there. There's also electrical shock, if you've touched some electric appliance or that has gone into your body. And then there's medical shock, when it's loss of fluid. So that's what we're going to be talking about in our next topic. So shock, there's 5 ways that someone can go into shock, and it's always to do with loss of fluid. So the first one is bleeding, so loss of blood. The second one is burns, when the body has again been damaged and the blood goes to the area. The next one is broken bones. So again, the body has been damaged and all the blood will rush to that area, and also there's fluid in our bones. And then also we have severe dehydration. So again, loss of fluid through dehydration. And then also we've got diarrhea and vomiting. So what will happen when somebody's going into shock is, for example, if I've just had my breakfast and we've eaten, so I've just had my breakfast and all my food is in the stomach. So at the moment, the body is digesting my food. So the blood has gone to my stomach. Now, if I burnt the whole entire arm, when the body is harmed, the blood rushes to this area to fix it. So what it will also do is make me vomit to close down the stomach so they can send all the blood to this injured arm. While the blood is working on this injured arm, the brain is getting starved of oxygen, and that's what shock is. So not enough oxygenated blood going to the brain. And if we do not treat this, you can die from this, because the brain does need oxygenated blood to survive. So what we need to do, and how we recognise this, is so it will always be caused by one of those 5 things, as I mentioned. So bleeding, burns, broken bones, dehydration, and diarrhea and vomiting. So one of those things has happened. So the first thing you need to do is treat that area first, and then the secondary thing, they may go into shock afterwards. So what you will see is the person will be going cold and clammy. So they'll be going pale skin, cold and clammy skin to touch. They'll feel quite nauseous. They may vomit. Their breathing will be really rapid but shallow, and they may go unconscious. So what you need to do is you need to lie them down. So treat the injury first, lie them down, and then we're going to keep them warm and raise the legs. And then call for emergency services and explain what you can see. So somebody has had a really severe burn and now they're going into shock. So that means you give as much information to the emergency services so they can send an ambulance to you. So let's just quick recap. So the 5 things that cause shock are bleeding, burns, broken bones, diarrhea and vomiting, and severe dehydration. What they're going to look like is they're going to go pale, cold and clammy skin, feeling quite nauseous, be quite agitated or confused. Also, they're going to have rapid shallow breathing, and they may go unconscious. So what you need to do is to treat the injury first, lie them down, raise their legs and keep them warm. Keep talking to them, keep reassuring them, and try and keep them awake as much as you can, and then keep checking their signs of breathing and their vital signs. Call 999 and just wait until the emergency services arrive. Thank you.